To travel from the left ventricle to the brain, blood goes through the arch of the aorta. On the right side, it passes through the brachiocephalic trunk into the right common carotid. The left common carotid comes directly off the arch of the aorta. Blood then passes through the internal carotid and enters the skull. It is around the position of the larynx that the common carotid artery splits to form the external carotid artery, which goes to, say, muscles of the face, and the internal carotid, which will pass through the temporal bone to reach the brain. There is an alternate route to the brain. Blood can go through the arch of the aorta, on the right side through the brachiocephalic trunk, to the right subclavian, on the left side to the left subclavian, which comes off the arch of the aorta, from the subclavian arteries into the vertebral artery, which then enters the skull. Inside the skull, the two vertebral arteries fuse to form one basilar artery, which then helps to form the cerebral arterial circle. The internal carotids also then help to form this cerebral arterial circle. From this circle, a number of blood vessels leave, which then reach various parts of the brain. Deoxygenated blood then passes through dural sinuses to the jugular. The internal jugular passes through the jugular foramen and will then fuse to the subclavian vein to form the brachiocephalic vein, one on each side. The two brachiocephalic veins fuse to form the superior vena cava, which then empties into the right atrium. Once again, deoxygenated blood passes through dural sinuses to the internal jugular vein, to the brachiocephalic vein, and the two brachiocephalic veins fuse to form the superior vena cava, which empties into the right atrium.